All right, Bernard. Second time I have you. I'm not gonna ask you to introduce yourself, but like since last time since last time we talked, I feel like you're like really, really smart about like understanding human body, understanding movement, and the people I work with, they say like you're really smart. So I need to learn more from you.
I appreciate that.
So, first thing I want to ask, la- I, last time we kind of talked about this a little bit, but still, um, for me, I forgot since when, but like for me, a lot of lower limb injury, especially like closer to pelvis, I'll start to look at SI joint. So I'll start with like asking you, what are your thoughts on like the overall SI joint and the lumbo-pelvic region, and like how that affects soft tissue injury?
Well, I think it's the lumbopelvic area, which I'll include the SI in there, obviously is very critical. I think it's a lot of sports therapists, at least in the past, were very much focused on extremities and joints. And I think, we target the core. The spine is involved with everything. And if you have neural tension issues coming from there, or even if you have a mild disc irritation that will affect function in the lower extremities. It can cause guarding in the hips, can do a lot of things, create a weakness that's going to present as possibly a lower extremity issue when in fact it's from the spine. So I think it's a critical area. It's one when I was working with the players directly, it's something I'd always keep an eye on, even if it's just checking a lot of basketball players lack hip extension because they do so much in a crouched position and bent forward. So hip extension can be an issue, which can be coming from tight hip flexors, which will obviously impact the spine with the psoas coming from the lumbar spine. So I think it's a critical area. The SI is somewhat, I think we touched on a little bit either off camera or during the camera, but SI is in some dispute. Some people have shown a lot of studies where it doesn't move. I've worked with rollerbladers who've, fallen on their butt and they'll have what I consider an upslip that I have addressed and they're doing better. To be open-ended, hey, maybe it's just a soft tissue issue and the what I am calling a sacroiliac joint mob is actually addressing the uh, the soft tissue and releasing that. Regardless, I think it is something that, hey, we want to take a look because if you're looking at the sacroiliac joint, and some people may have hypermobilities, there's different disorders, but you've got the hips there. That's going to impact hip internal, external rotation, potentially leg length. So whether it be restricted tissue limiting the motion in that area, or whether it's actually the joint, I'm not going to nitpick and get into arguments, but I think it's an area that you do need to look at. And that includes adductor mobility, abductor strength, everything around there, because I think those are all factors that if you have a stable core, which I consider the lumbopelvic area part of your core, that's going to help your quads, your ankles, and everything. If you don't have a stable base, which that is really your base, you're not going to be able to function optimally in sports.
Nice, nice. All right. What about scoliosis or spine?
Scoliosis is what it is, right? If you've got scoliosis, a lot of the people that I've worked with that have a scoliosis, they're fine until they're not. So the problem with them is if you've got everything working fine, they do great. But when they get an issue, now that imbalance of tight versus elongated becomes a factor. So they're a little bit trickier to get back comfortable. I don't think scoliosis is a deterrent to playing by any means. It just means that, hey, if somebody irritates their back or their hips and they have a scoliosis, for example, if you're looking at the sacroiliac or lumbopelvic alignment, you have to know, hey, when somebody's got a scoliosis, that affects mobility, that's going to affect rotation, that's going to affect a lot of things. And if you look a static position, you're going to say, wow, this person's off. But there's more to it than that. I think again, I've worked with players with scoliosis. I've worked with coaches that have scoliosis. We keep them fine. It's just it's a little bit trickier when something happens because now you've got that added mix of, hey, the quadratus on one side is shorter because of the curve in the spine, and that has to be addressed because when something reacts, it just increases the shortness, increases the lengthening on the opposite side, and creates a little bit more of a challenge is all.
Nice, nice. All right. So another like this is probably gonna be a little tougher. So in my experience, just me personally, like working with athletes have SI joint issue, working with athletes that have like scoliosis, those are I feel like those are skills that like you really need to have really good coaching eye. So with and I do feel like these uh like the guys that have scoliosis, they're gonna be fine until it's not, right?
Right.
And then there's all of a sudden a lot of stuff pop up. You need to address a lot of stuff.
Mhm.
Kind of the same with I feel like it's kind of the same with SI joint. So, all right, here's the thing. With all the with all the biomechanics lab right now, uh, me personally, I don't believe those stuff can track how the spine move, how the pelvis move, or how the SI joint move, right? So how can we incorporate that?
Oof. I mean, see, there's a lot of layers to that question. So one thing that I do is when I was working with players, I like to always get them on the table a little bit. So for example, if you had somebody with one of those issues, whether they do or not, but say somebody has that issue, we always get them on the table for like 5 minutes, just a quick check, just to make sure your motion's good, your tissue's good. So those are little preemptive things we do. We don't let you get completely torqued out. Now, sometimes injuries will happen, but from a day-to-day maintenance, we get you on the table, do our little bit of prep, get you into the gym with your activation and your strengthening, and we may strengthen a little bit differently when you've got one of those disorders because there's a different balance at work here. As far as the biomechanics, again, you're going to need baseline data for that person because if you're comparing it to the norm, hey, if you've got a scoliosis, you may not rotate well to the right. You may have changes in hip rotation from side to side, which would be an asymmetry on a biomechanics test. And I don't do a lot of the biomechanics testing, but we're looking at symmetry for most of these. And you've already got an asymmetry there. So you have to have their baseline and say, okay, if that was me, that's abnormal. If that's this individual with a scoliosis, that's their normal. And then you have to compare it to what their baseline when they're feeling good. So I think that is one of the things you have to look at. And one of the things I did a lot when I was in the league was I would talk to the coaches because the coaches aren't PTs, ATs, they're not medically trained, but they've seen these guys on the court and they can pick up things. When I was with Detroit, Coach Casey could just tell me, sometimes go like, something's up. This guy's not going into the key as much. He's staying out. There's something wrong. And then that would make me look and say, what's going on? So he's not going to be able to say, I think his hip's bothering because he's not pushing, but he would say, he's not playing the same. He's not moving the same. And, you know, these coaches have well-trained eyes. And again, it may not be a biomechanics discussion, but they know how guys move, they know how they play, and they can tell when something's not right. And using them, working with them, again, like we spoke before, the collaboration, it's not just PT, AT, massage, dietitian, strength. It also involves the coaches because they see the product on the court, which at the end of the day is important. So again, biomechanics are a tool if you've got somebody with an absolute disorder like that, or if they've got a known, for example, if somehow you had somebody just say something crazy in the league with a fused ankle, which highly unlikely, but say you had somebody with a fused ankle, that's obviously going to affect biomechanical testing. So, you know, I don't know why I bring Bill Walton into it. That was well after he was done playing, but that's the thing is you have to look and say, okay, we already know there's an anomaly and we're going to have asymmetrical testing. Take that into consideration, what's normal for this person.
Hmm.
I don't know if that answers your question, but
Yeah, yeah, of course, of course. So, since last time we talked, you mentioned a lot of times we talk about these stuff. You talk about on-court movement, which I do feel like we're as a I don't know about medical staff, but I feel like as a strength coach, we are starting to lose those ability to like watch how athlete move, right? So when it comes like on-court movement, like what are some stuff you're gonna look into? What are some like maybe like change of direction, deceleration, like what type of movement you're looking at?
partly it depends on the position. So, if you're a point guard, you're going to be doing a lot more change of direction, a lot more fast acceleration, deceleration, cutting to the side. If you're, say, a five, you're going to be doing a lot more possibly body contact into the paint. And, yeah, we've got Wembanyama, we got Embiid, more skilled people who can do things differently, but they tend to be in there and banging. So it depends on the style of play. But what I did when I first started out as a PT before I got into sports significantly, when I would follow motion, I just start from the ground up and I just start watching general things, looking at, okay, how are they moving with their feet? Does it look like they're biasing to the left? Like, are they always cutting left? If so, why aren't they going right? Let's force them right to see if maybe they're protecting something. From there, you start looking up, how are the knees? Are they dipping in? Is one going in faster than the other into more valgus? Does it seem that they rotate equally? And just kind of work up the chain that way. One nice thing is for a lot of practices in the league, there's cameras, and sometimes you can get those, and then you can try to slow them down and watch that. The other thing is, the beauty is with practices, you will get data. So again, like we spoke, you're never going to practice as hard as you play, but we can see, wow, a normal practice for this individual may have, hey, say they practice for a little over an hour and he gets half a mile of high speed running, and it typically involves X number of high speed accels, decels, and you can even see with some of these, like the connection, you can see where they're going on the court, and you can use that to just kind of take what you saw, add into that, and say, okay, it does seem that they're not putting on the brakes as much, which then you start to break down if they're not putting on the brakes as much, why would that be? So um, at speed and with the naked eye, it's hard sometimes to just say, you see that. If somebody's walking, it's a lot easier. But when you take all the tools available to you, you can start getting the cues. I will say one of the things that always cued us in early was when we'd look at the data and say, wow, they're not hitting the brakes as much. Or, boy, their speed's dropping. Now, is that fatigue? Is that an injury? Is that protecting something? That's where the assessment and the analysis goes. But at least it opens your eyes to say, we need to take a look at this.
Hmm. All right. So, uh, one thing that like related to movement is injury, right? And we kind of talked about last time. Well, last time we kind of talked about like building a framework for return to play for each cases.
Mhm.
So, when it comes to decision making, let's go through layer by layer. What would like what would be how can I ask this? Like
Of the
from
decision-making process.
yeah.
Yeah. Well, I mean, first off, like I said, a lot of times coach may have some insight, say something's up, or player's going to say, this is bothering me. Or you saw an injury, right? So if we're going back to the return to play injury, honestly, I would work very hand in hand with the head trainer, the performance director, and just start saying, okay, hey, what are we seeing? What are you thinking? So the final decision when I was the director was mine. So if there were cases on occasion where the head trainer and he was like, I don't know if he's ready. And I'd say, I think he is. And basically, I have that final say. Now, that comes with if I'm wrong and I put him back too early, I own that. I think as a leader, you have to be accountable. You have to own your decisions and you have to look out for your team. The way I looked at things is any decision made by my team by default, I was okay with because, hey, man, if there's a problem, I'm not going to be the leader and have somebody go after one of my staff. It's like, no, no, you come to me. I work with staff. If it's good, the team did great. If it's bad, you come to me. So we would have these discussions and we would look at the numbers in practice. We would see the response. So, for example, say somebody's coming back from an ankle sprain. Simple things you're going to look at is the response to what they're doing. So, how is the swelling? How is the motion? How do they feel? Again, like we talked about with evidence-based practice, you have to take in their input and your experience as well as the evidence. So, how are they feeling? How do they think they're doing? We look at the data on the court. You know what? Hey, that ankle, I know you say you're feeling good, but you're not running as hard. I notice that you're not putting on the brakes. You are never cutting to the left. You don't want to push off that right. So those are factors we look at to get back to play. All those numbers have to line up. But we have everything, even in the weight room. Strength coaches and performance director are going to tell me, hey, this is what's going on. Here's what I'm seeing. He can't move as much. Or we would get him on the balance testing. I'm forgetting the name of it now. The computerized thing. And we would look and say, hey, you know what, boy, they're struggling there. So we took a lot of data and we would look. And again, like we talked before, you have to pass all the indicators to move into phase two. So as long as you are holding somebody in and you set up a plan and you put serious KPIs markers that it's like, you don't say, well, they're close, we'll move them on. They hit this, they move on. And this is for an injury that's not like, hey, a 1 day out, right? If there's certain injuries where you know they're fine, they're going to be out for a day and then they're going to be back. But so when they hit the markers and you take them on and then boom, and then as they get farther down, we start testing them in practice. They have to practice fully for at least a couple of days, preferably a little bit more, depending on how long they've been out, and have the numbers hit. We need to see that speed. We need to see those accels, decels. We need to see that they've hit the type of distance they would do to show that they're ready physically. And then we would all sit down. It was never I'm going to just sit here and make a decision. I always got input from the trainers, from the performance director, from like anybody involved and the coaches. Like, how do you think they're doing? Because I might think they're doing great, and the coach is like, not moving well. Well, if that's the case, I'm going to work with the development coaches and say, hey, we need to do some of these things. Here's what I want to see him do. Make him cross over to the right, like force him there. Gets if it's somebody who needs to run more, maybe we do a 3-on-3 full court. So they're getting some distance. If it's more cutting, maybe it's a half court with more bodies so that there's a lot more maneuverability and quick reactions they need. So it's again, it's individualized, but I think it's a team effort. It takes a village to really get accurate. And my biggest thing is even though the end decision was mine, I wanted to make sure I had all the information. I'm not missing anything. And the staff that I worked with was always great about saying, "Hey, man, I think you got to look at this, or I like this, or I don't like this." And I trusted the staff, and when they made points, they had the reasons for it, so it helped make better decisions. I mean, easy to look back, but I don't think we ever brought anybody back too soon. Could some have come back faster? Probably, but we didn't bring anybody back too soon.
Cool. So, like last time you said, uh, if you collect the data but you can't make any decision out of it, it's
Right,
noise.
right.
So, what kind of data, when it comes to like decision making, what kind of data you're looking at, and like what kind of data is noise to you?
Wow. I mean,
I know this is a tough one.
Yeah, that's a tough one. Like, I mean, it's weird. Like early on with the sports science, they gave us so much information, and some of it would be like, "Wow, that's really interesting," but it was just that's kind of cool. But I don't even know what we could possibly do with that. I mean, the things that I would look at from a sports science standpoint is truly the basic metrics that we would look at in a game. We look at how far you're running, your high speed accelerations, decelerations, total accelerations, decelerations, um, max speed. I mean, those are indicators of preparedness. And we're going to run them through some drills as well. So that's not necessarily sports science, but we'll also do force plate testing. We will do some time drills just to say, okay, how fast, like under a basket, coming, side to side of the lane, back to back, how many can you do in X number of seconds just to see physical performance. But those would be the main things I'd look at. I mean, they can look at intensity minutes. You can see a percentage of your running that's high speed, not just distance, and things like that. And there's some people more versed in the sports science than I am, and then they could flag that. But the basic things I looked at is when you're healthy and you play, here's what you do. Can you do that? So nothing super fancy for me. Like I said, the force plate, like we talked about before, it's not the final decision maker, but it helps to see if they're generating force, how fast they're generating force. Are they able to load equally? Like if they're jumping and obviously favoring one side and that lines up with the injury they had, maybe we've got some more work to do.
Hmm. And kind of go back to where we talk about scoliosis or SI joint is they typically would bias one side, right?
Sure.
So how much of the spot like shift from side to side is okay for you? I know that it depends, but
Yeah, I mean, it's based on their norm when they're feeling good, to be honest with you. And now, if there was say there was a player who, because of their normal dysfunction, rarely went to the right, they're not going to be around long because every coach from another team during shoot around is going to be like, this cat doesn't go to the right. Load him on the left to force him right. So that would be a weakness in your game that would probably stop you. So I think if you're getting to at least the NBA level, you probably don't have a huge deficit there. But if it was somebody like that, it's again, we look at the numbers. What do they do when they're feeling good? What are they doing now? If you can look and it looks like they're mostly moving to the left, and we're doing some force plate testing or we're doing other testing, we see that boy, they're protecting that left side like they don't want to push to the right. Okay, something's right. And then we talk to the player as well. Hey, what's going on? This is what I'm seeing. And if they say like, no, everything's fine. Okay, well, we need to see it on the court then because I don't believe you. And here's why. Here's what I see on the force plate. Here's what I see the numbers on the court when we're doing this. Let's watch the tape. Boom. Look at how you're always doing this. So, using that type of information. And again, I think a big thing for me was when the athlete knows that you've got their back and you want what's best for them, they'll tend to be more open with you. I mean, you've got to earn that trust. It's not given. But once you earn that trust and they know that you're not going to throw them under the bus to protect yourself, they'll be open with you.
hmm. All right. A lot of stuff we talk about is SI or scoliosis. What about foot and ankle?
Yeah, I mean, I think foot and ankle is huge, right? I mean, feet in the NBA, a lot of flat feet. As we talked about before, you make your living on your feet, so those dogs get beat up bad. Um, I had one player who always wore his feet were gnarly, great guy. But when he was growing up, didn't have a lot of money. So he always wore shoes that were too small. And now, even though he was in the NBA, it's how he played. He wore shoes that were too, and you'd look and go, these shoes are too small. That's how they play. Okay, well, I'm not going to tell somebody that's not, I can say, Would you want to try this? Would you want to do this? But at the end of the day, they got to that level. If that's what works for them, I'm not going to change that. I'll give them my 2 cents, but it's their call. Um, but as far as the foot ankle, again, I think the biggest things that I see that become issues are when you're not paying attention to the range of motion. The one in particular for me is dorsiflexion. That's the real simple, low-hanging fruit. They've got to get dorsiflexion because basketball players do so much in a dorsiflexed position, especially if you're a guard, but all players, based on how the game is, you need your dorsiflexion. Just full dorsiflexion. Not everybody has the same amount, but you need dorsiflexion. You want to make sure they have control with inversion, eversion, because obviously rolled ankles. And I think, having worked in baseball, for example, and I've talked to a player recently about this, you may have torn your ATFL, you may have some changes at the CF as well. Passively, you may have an unstable ankle. That doesn't mean dynamically you're unstable. And my example is a baseball pitcher. If you are a baseball pitcher, your external rotation isn't 90 degrees. It's sometimes going to be at least 120. I've had people at 140 degrees of external rotation. If you're laying on a table and didn't tell me you were a baseball pitcher and I checked that shoulder, I'd think you have anterior instability. And yet they can throw 100 miles an hour and that humeral head just spins in there. So there's a dynamic control. And that's what's relevant. So I may see all these things and say, oof, but we train you and you can dynamically control your ankle. So, what is your dynamic control? And there's different ways to test that with balance testing and things like that. So that's another check we have. Um, Kind of bummed I'm forgetting the name of the machine, but we use it in Detroit, and forgive me. But it was a great machine because we could see every little perturbation and we would measure and we could see the improvement when we trained people. And the better they did, we saw either fewer ankle sprains or we saw less time off when they did sprain their ankle, which is telling me they developed a better dynamic control at the ankle. So I think with that and great toe extension, I think that's one area you've always got to make sure. So when I go through people on the table, one of the first things I do, ankle dorsiflexion, calcaneal motion, big toe extension. Just that's kind of my like priming the pump before they even get out to start doing stuff in the weight room. So yeah, I think foot ankle is basically what's got them on the court. So it's again, the foundation is there. Everything starts from there. That dictates so many aspects to a basketball player that, you know, of critical importance.
Nice, nice. One thing when when you talk about foot and ankle, and uh, you kind of mentioned that if someone tears their ligament, like maybe it's in a pathological standpoint, it's unstable, but functionally probably it's not.
Mhm.
So this kind of well, I'll say this. So how much does pathology really matter when we talk when we talk about like injury, all those stuff? And if you're talking about elite athlete, probably especially basketball player, they all like have uh was degenerative disc. They all probably have like some sort of like labrum tear, some here and there.
I mean, you look at NHL players, right? And I would say, I think I saw a study that I think over 80% have at least one labrum tear in their hip, and they're fine. So just because you have a labrum tear does not mean that you're stopped. Now, some it does, and it depends. Is there a flap? Is it new? Um, but yeah, I mean, it's the fact that there's a pathology there does not mean that it's stopping you. I mean, the like I've never worked with this guy, but I know that Michael Porter Jr., who's now with the Nets, I mean, it's well documented that he's had back fusions and he's playing in the NBA. And, had I been on a roster, had I been with a team when they were doing medical evals on that, boy, that's a red flag. And yet, Denver drafted him in the first round, kind of had that year to recover, and can't argue the guy's done great. If I had made a bet, would I have thought he's playing A, this well, and B, this long in the league? I wouldn't have, and I would be wrong. So it just goes to show you that pathology alone does not mean they're not going to play. Uh, as far as ankles, yeah, the most common injury is an ankle sprain, right? And you're going to step on somebody's foot. The point that it becomes an issue is when you are chronically unstable. So if you sprain your ankle two, three times in a season, and you're out a little bit, I don't think that's a big deal. But if you are chronically unstable, or if you will roll your ankle in the weight room, or just doing shooting with the development coach, that now you are chronically unstable, that may require something like a surgery to tighten things up because now you're not functional. So there are pathologies that people can control. Once they can't control them or once they can't do it, then you need that involvement. But I mean, I had worked with a player who had a labrum tear. We had a lot of checks, and it was just like we were determined we did not choose to have surgery, and continues to play years later. No issues there. So, yeah, I mean, the injury alone does not dictate that, uh-oh, you've got to do this. Sometimes yes, sometimes no. That's partly the player. Obviously, team agents, doctors have input on that as well. But, I worked with a guy that had a complete rupture of one of his adductor muscles, and recommendation was surgery. And they weren't all gone. He still had, I believe it was the adductor magnus was still going, but everything else was gone. And it's just like, yeah. And he asked me, and I said, honestly, I said, you're going to do what you want. He goes, what do you think? I said, I think we can get you back. And we rehabbed him hard. And I give credit to my performance director at the time and the staff that worked with him. But no surgery, came back, played free, no restrictions on that side, went on to play multiple years after that with no negative impact. And in fact, won an NBA title where you are right now. So, um, it just goes to show like that was an injury that other people have had surgery with. And we discussed it. He opted not to have the surgery. We rehabbed, and it wasn't that long of a layoff when you look at the severity of the injury. Came back in that season, finished strong, and like I said, continued to play. So other people have had that same injury and had surgery and been down. I'm not saying surgery is right or wrong. In this case, did just fine without it.
So when we talk about like uh all these biomechanics stuff like SI, spine, foot and ankle, and I feel like I don't know about medical side, but I feel like when it comes to biomechanics, we often say like structure dictate function.
Hmm?
But like we just discussed, sometimes pathology, pathologically wise, they are not that good. And so how like what's the balance there?
Yeah, I don't know if there's a simple answer on that. I mean, I think obviously structure can dictate function. So if you're somebody like me, my hips are anteverted. So, if you look at a LeBron James, his feet are out like this. You look at me and I can put my feet in like this. I'm a pigeon-toed dude. Um, we're not changing that. My hips anteverted. I'm going to be pigeon-toed. I'm going to have more internal rotation than external rotation in my hips. Just the reality of it. I learn how to move with that and I'm fine. That's different than now I've thrown in a pathology. Say I have a L5S1 disc on the right that's created limited motion, guarding weakness on the right side. Now that translates into that's got nothing to do with my hip aversion. Now there's a pathology that's affecting how I play. Do we rehab this and get it back? Or what point do we draw the line where it's like, okay, we need further medical intervention? That's where you have to have the consultation with the doctors, with the player. What do they want to do? What are they doing? And again, you're going to look at the force plate testing, the strength testing, the movement on the court, the stats on all that. You take all that into account and say, they're not playing well. This is affecting their play, and this is going to go down further. I mean, on a different kind of example, when I was working in cycling, I had one of our potentially Olympic mountain bikers had a crash. She tore labrum in her hip. And it was just like, you know what? We're coming into the qualification series. It was the end of the year and then the beginning of the year. Those were the races that determined if you made the Olympic team. And the discussion we had was you have the surgery, you're down for this period of time. You've taken some of those qualification races out. So you've tightened up the opportunity for you to make the Olympic team. Based on our discussion, I thought your performance is going to degenerate because of what she was telling me already, the limitation she had on the bike. And I was like, this is not something you're going to get better. You can tolerate the pain, but you're generating less power. So my recommendation that she went along with was, you know what? Have the surgery now. Let's get your recovery going now. And then you're going to be fit to go full gas in the remaining qualifying races. And if those go well, you're actually healthy to race in the Olympics rather than getting there and going, man, I'm a third of what I was. And to her credit, she did that, qualified for the Olympic team and raced in the Olympic Games. So, it's not always an easy decision, but you've got to look at the big picture as well. It's sometimes it's a matter of, we talked about the other day with, injuries that you may have held out, but when it's game 7 of the finals, maybe you take your chances and that's the athlete's decision. I take the chance to go. So um yeah, it's not a real easy answer, but I think if there's a pathology that is negatively impacting their performance and this isn't something where it's getting better on its own, okay, maybe we got to get something in and let's cut bait and get you as healthy as we can. And that happens. I mean, I think towards the end of the basketball season, sometimes there's decisions that maybe they would have tried to rehab, but it's heck with it. If we're not looking to win, let's go ahead and just take care of this, shut you down. There's different situations, but
Mm.
I don't know if that answers your question. But
Yeah.
yeah, I don't think it's a black and white like, oh, this or that. It really depends.
Mm. All right. So followed by that is obviously working with a high performance environment is hard, and people are probably gonna disagree with each other a lot, especially like return to play, return to performance. So how do you handle those situations when like your performance staff and your medical staff like don't agree on each other?
Well, the biggest things we would do is it's again, like I told you before, the final call was me. So if everyone said don't play, and for whatever reason I said to hell with all of you, I say they're playing, I own it. I'm accountable. If I say yes and it goes bad, 100% on me. Or if I said they should, but I went with everybody else saying no, and maybe they could have, still on me. That was my decision. What we would have is little meetings. Sometimes it was the entire staff, sometimes it was the doctors, head trainer, myself, and the performance director sitting in a room and just saying, here's what I see. Boom. Here's what you see. Boom. I think they should play. Here's why I think they should play. I don't think they're ready yet. Here's why I don't think. And we would have a discussion. And sometimes there were points that was just like they're not bending on one, I'm not bending on the other, but I hear it and it may sway my decision at the end of the day. But everybody had input into it. But in my role, and I think that's for most of the, say, I would think it's a, VP of health or medical director, whatever the title is for the team. That final decision is theirs to report to the team. And as long as you're accountable and you own it, you know, there's no crystal ball. I mean, if you want to be safe, you're always going to hold out people longer. But hey, man, this is a big money business, and every time you've got one of these players making 40 mil a year, every time they don't play, that's conservatively say they make 40 mil a year. That's almost a half a mil per game that they're not earning, right? And some people are coming, you take into account, hey, there's people that this may be the only game they come to and they want to see that. So that's something, again, it doesn't guide your decision, but you have to be alert to that. And, coaches want their big guys. If it's a fourth guy off the bench, okay, yeah, hey, don't rush him back. If it's somebody that we need to make a playoff push, I need this guy back. So you get the pressure from the front office, the pressure from the coaches, like, he seems fine. He seems fine. Why aren't you going? And those are the tougher ones. I mean, with the medical team in general, it was rare that it was a they cannot play. It might be, I think they should take a few more days, but it's generally we were within a few days of they're ready to go. It was very rare that it would be like, hey, I think they should play. And it was just like, wow, they're not even close. That really didn't happen very much. But we had pressure from the coaching staff and from the front office because, like, we need this person. That's the tougher stuff. And to stick to the guns. And again, that's where it was always, I'll stand in front of you and you can give me all the heat you want. And I just take it. I mean, it was funny. There were times that I would get reamed by the coach in front of everybody. Didn't phase me because I knew it wasn't personal. He wasn't saying like you are an asshole. It was nothing like that. It was just he wasn't getting what he wanted to hear. And it's kind of like, you hear the old story about, hey, you had a rough day at work, you come home, kick the dog. I was the dog in that situation. I never took it personally. I know it was just venting. We got along great. So you have to be able to stand your ground. And I was always very comfortable. Like I told you before, I would rather lose my job doing the right thing than keep it doing the wrong thing. So if I am not doing this on a hunch, I have my reasons for why I'm saying no, this person can't play, or yes, they can play. I'm comfortable with it. And no decision's ever perfect, but I'm comfortable with it because I took the available information and I made an educated decision and I will own it. And if somebody has an issue with it, I'm never going to say, well, my performance director said this and I knew they were We had that discussion. I went along with it. You talk to me and I'll own it. And if you want to rip me a new one, have at it. I'll just sit and smile.
Nice. All right. So, uh, last part of this podcast, I want to ask you because you were in a leadership position.
Mhm.
So when it comes to like building your own apart, uh, building your own staff, hiring your own staff, what are some qualities you're looking into?
It's a great question. That is a great question because there's a lot of different pressures that you get. Now, when I got to Detroit, for example, I was hiring head trainer, assistant trainer. Our performance staff and strength staff were already in place. We didn't need to hire them. Now, I met with them and I spoke with them, but I didn't have to worry about them. Now, when new people came or when we hired for different positions, I was involved in that. My biggest thing is obviously you got to be qualified. That's a no-brainer, right? I'm not going to take anybody on a flyer going, well, you'll learn on the job. You have to have some basics. Like you need to be qualified, number one. But my biggest thing was we're together, and sometimes I might just say something stupid. I might, I'm going to drop an F-bomb, which I do with too much regularity. I'm going to say something just to see your response. Because you know what? when you're with a team, as you well know, during the season, you're with these people you work with more than your wife, your kids, your family, period. So I needed to know that, you know what? These are people that I could hang out with, not necessarily being best of friends. And I will say one of my weaknesses early on, which I've had to work on, is I'm somebody who from the get-go, I'm all in. Partly, I think it's probably being French, to be 100% honest with you. I'm all in. If I accept you, man, we're family. And I realize, you know what, sometimes there's work relationships, and some of these people will become lifelong friends, and some people are just going to be coworkers. And I've learned that, it's a hard lesson, but it's the way it is. But you have to be able to discuss. It was funny when I hired Jim Scholler as my head trainer. We did a performance appraisal early on, and we were in the assistant general manager's office, and he was like, I gave this a 5% chance of working. And I was like, what? But I love Jim. But Jim is you know what? He's not going to sugarcoat it. He's not going to beat around the bush. He's going to go pow, tell you straight up. He had a saying that I've taken and I use to this day: as bad news does not get better with time. So we would have conversations. We didn't always agree, but you know what? It was mutual respect. And I respected what he knew. And he helped me out a ton. And we got along great. He's a friend to this day. Um, but I knew that, you know what? If we were having a rough stretch, we could go grab a beer or something and we'd be fine. Or if I was just struggling, I could talk to him and he'd be like, we're good. We do this. So to answer your question, I think you need a team that can work well together, that can get along. They're not all going to be the same. We had a strength coach who's now with Portland, and man, I tell you what, that dude never had a bad day. I mean, I don't care if it's raining cats and dogs, and we had three guys go down with injuries, and somebody else is sick, and we're in a 5 game lead. You know what? It's a great day, man. This is what we're doing. We love it, and love that guy because you know what? You look at that, you work with somebody like that, and just suddenly like, you know what? You're right. I'm taking this as a huge problem. How lucky am I to have this problem to even where like I'd have killed to be able to sweat this problem out. Yeah, there's pressure, but you know what? At the end of the day, man, it's a job. In a year, is this going to be something that's like, oh my God, this tore me? It's a memory. So had to get along, and that's different personalities. I mean, the staff we had, you know, couple of blunt people, some very political people, but all smart, all qualified, and we could get along. We would have team dinners at Summer League. We would periodically on the road get together for dinner just to mash it up. So I think I don't care about what gender you are. I don't care about how old you are. I don't care about what nationality you are. Can we work together? And can we, if there's a problem, like if I say, hey, Eric, doing a great job, but you know what? This needs to pick up a little bit. Boom. We can have a discussion. It's not going to be, oh my God, they're attacking me. It's just like, it's all constructive. You know what? We can always do better. And it's just realizing that we're all on the same team. We're not going to throw anybody under the bus. And to me, that is critical that you've got a crew that you don't have to all be best friends, but you got to be able to work together. And I think if you like each other, it's even better. Because it makes that year go better. So I always felt if I like somebody and they kind of match my personality, now I want to see what the rest of the staff thinks of them. Because hey, I know some things that I like dumb jokes. Hey man, I'm a Deadpool guy. Maybe you don't like comic superheroes, So if somebody's into this, I'll be like, that's awesome. And they'll be like, this is stupid. Let's make sure that we're all on the same page. Nobody's going to be a perfect fit, but you know, it's I want us to be able to have conversations, open, honest, trust, which you build together when you can have those conversations. And if you have that, you'll build a great team.
Hmm. All right, last question before I let you go.
Hmm?
So, for young guys out there who want to make the league. Not necessarily NBA, not necessarily like NBA, Major League Baseball, NFL, NHL. Young guys out there, young physical therapists, young strength coaches, young AT out there who want to make it. What are some like advice you would give them?
Well, first off, understand what you're getting into. I think it's a lot of people think this is awesome. What I used to love is like, hey man, what are you doing this weekend? I'm working. Hey, what are you doing for Thanksgiving?
Right.
I'm working. What are you doing for Christmas? We're flying to LA. I'm working. It's like you work all the time. And some people think the awesome things, sports, man, it's great. You're working with athletes, you're going to the game, you get to hang out with your family at night. No, you don't. No, you don't. And then my role, like man, before the draft, I'm getting called like it used to drive my wife nuts. I was getting calls at 11:30, 12:30. Tell me why we should draft this guy. Tell me something about it. And it's just like, she's like, why are they still calling you? This is a big deal. This is a big decision. So understand what you're getting into. I did a talk at the combined sections meeting for the APTA back in 2023, and it was like, so you want to be an NBA therapist or medical director. And it was basically just being honest. Like, yes, here's the cool stuff that everybody goes, man, that rocks. Yeah, you're staying in great hotels, you fly all this, you're around all these guys. But here's the downside: coaches, the pressure. I would get people all the time. Hey, what's up with this player? Hey, what's up with this player? It's none of your damn business what's up with this player. Um, so the hours, you got to realize it's an all-encompassing job. It's not like the off season is a maybe less busy, but there's no such thing in an off season. You may be rehabbing guys. You've got summer workouts. You've got summer league. You've got draft workouts. You've got all this. So it's all there. You've got to understand that. I think just coming out of a residency is good, but you need to kind of understand. I think personally, I think you need to get some clinical experience because I think that's a value. Work with people, not necessarily athletes, work with normal people because if you can fix them, man, you can fix anybody. I think doing internships can be helpful if that's something you really want. Now, if you've been in your career for 10 years, you know what? It's probably tough to take a non-pay or very low-paying internship. But when you do that, you get on the inside, you see what it's really like. You can help a team. They can see how you fit and your work ethic, and that can help. I think, yeah, going to courses can be helpful, but it's like everybody's going to those courses to network, and it's just a matter of how good are you at networking. But I think, hey man, I had people who worked who would just through LinkedIn send me a message, ask me questions, and they've been doing some great stuff, not because of me, but I'm always happy to reach out. If somebody reaches out, I feel my responsibility to my profession and just to be a good human being is I'll always respond. I'll always help you and give you some advice. And I think I'm not the only one. Um, but I think getting around it and being willing to put in some time, understanding that, hey, man, if you're just coming in, you're not necessarily starting out as the director. You may have to grunt it. You may have to start out in the G League. You may have to work, maybe start high school and that, but that's the way to do it. Now, I'm not going to lie, a lot of dumb luck. I mean, sometimes you got to get lucky. Now, I also believe you put yourself in a position to be lucky. The last consulting role I had with a very high profile player just recently ended. It was funny. I was working with somebody else and somebody's like, oh, are you working with this person? I'm like, I don't normally say, but yeah, no, I'm not. Like, are you kidding me? And then I end up working with this person. Lucky, yeah, but I put myself in a position to get lucky because they sought me out saying, hey, we got your name from these people. So I think do good work. Networking is important. Jess Ellis talks a lot about networking and he does some stuff through Rehab Code that I think is positive. I haven't done it personally, but I think it's helpful. If you can find somebody to mentor you, but it's really you got to be willing to hear no. Realize the first times you try it, you're probably going to get a no. You have to realize a lot of times hiring's going to be done before you ever saw that position posted. And it's going to be like, what do I got to do? And you know what? Be willing to hear no a lot of times, but just I think doing things at the Olympic Training Center, you can get incorporated with them. It's like a 2-week internship. You get to work with different Olympic athletes, see how the training center works. You get to learn what it's like to work with strength coaches, therapists, trainers, doctors, chiropractors, different athletes, what motivates them. Boom. I think that opens your eyes. I did a 2-week residency there before I got my sports certification. It was awesome. Worked big wrestling tournament. I'd never worked wrestling. Now I've worked with a Filipino wrestler who's done phenomenally. And you start seeing sports that you never would have dealt with, and it's great. Then you start problem solving better, going like, wow, I didn't know that a fencer would have this, or wow, I didn't think about a boxer with it. That's a different kind of thing, but you start breaking down analysis. So, I mean, I wish there was an easy thing that if you do ABC, that's how you get in, but you can do everything right and never get a sniff. I'd love to tell you this is the recipe, but hell, it took me forever to get in. And then when I was out, I had to find my own way to do something different. So, you know, still think I can do it.
Of course,
But
you're one of the best.
but you do what you do, right? And it's again, it's kind of I guess I'll go into one of the stoicism things is that you know what? You can't control what other people do. You can only control your response to things. So if you get a yes or or if you get somebody that does you know what? Don't react. Learn, respond, adapt your behavior as needed, but just keep taking everything as a lesson to learn. And you know what? If you keep doing the right things, getting around the right people, making the right impression, they're going to notice it, and that may be the key to opening the door.
Hmm. That's all the question I have for today. I appreciate you,
Awesome.
man.
Absolutely. It was great, Eric. Thank you.